A hearty good morning, good afternoon, and welcome to a session on what you should know about male infertility. We're glad to have Dr. Malti Madhu among us today to help us explore this topic. Male infertility is lesser talked about today, but it's another factor that we should absolutely consider while exploring fertility as a whole. There can be many factors contributing to the life to this, like lifestyle, your diet, and more. So let's try to understand this and explore this as a topic in today's session. Doctor, you have the stage.
Thank you. Namaskar. This is Dr. Malti Madhu from Apollo Fertility, Noida. I am the senior IVF consultant working with Apollo Fertility, and I have almost 19 years of experience in this field. And one of my field of interest is evaluation and treatment of male infertility. As we all know, that 15% of the couple on average have problem in conceiving. So the overall incidence of infertility is about 12 to 15%. So in about one third of cases, the reason for infertility lies in male. In another one third of cases, the reason is in female. And the remaining one third of cases, the region is combined. So, roughly speaking, almost half of the cause is due to problems in male. So, the male partner is often overlooked. So, how to know that a couple can have problem of infertility due to the regions that lie in male counterpart? Whenever the couple have difficulty in conceiving of after 1 year of unprotected intercourse, they need to go to their gynecologist or fertility specialist. The evaluation of both partners After evaluation of both the partners, detailed history and physical examination, tests, initially the blood tests and then proper tests for fertility are performed. For male partner, it's the semen analysis. The male partner gives semen sample in a sterile container, and usually 3 to 5 days of abstinence is recommended before giving the sample, and then that sample is examined for the sperms. The sperms have three parameters like the count of sperms, and then how what percentage of the sperms are really motile and how many of them have normal morphology. So roughly speaking, about 15 million per ml of a sperm count is the usual normal concentration of the sperms in the semen. 15 million per ml or more. Uh, At the same time, during performance of semen analysis, we can be assured that whether the problem lies in male or not. Sometimes the semen parameters are normal, but male counterpart has sexual problems like problems of erection or ejaculation, and in those cases also the detailed history examination and some of the blood tests, we can reach up to diagnosis and treat them accordingly. So, speaking, what is the reason behind male infertility? First of all, talking about lifestyle factors, as we all know that there has been a real upsurge in the use of mobile phones, then also in the sedentary lifestyle. The incidence of obesity has also increased in recent years. Then the increasing use of alcohol as well as cigarette smoking and drug abuse. This all, all the factors can influence the semen parameters and can result in male infertility. Then there are specific problems of testis or hormonal problems. As we all know that the sperms are produced in testes, and for proper production of sperms, certain hormones are needed, like testosterone, FSH, and LH that are secreted from pituitary. All these hormones should be in proper concentration to maintain proper spermatogenesis. So, any interference with the function of pituitary or some blockage uh, in the genitourinary tract uh, that transfers the sperms from the testis to the external genitalia. Any blockage in that system that may also affect the semen parameters. So, grossly speaking, the semen parameters can be affected adversely, and if there are, I mean, mild interference with the semen parameters, then that person can be helped with the use of certain drugs, oral drugs, or sometimes injections of hormones for 6 to 9 months. And in some cases, IUI or IVF is needed. So, depending upon the semen parameter, the treatment plan is tailored. Uh, Speaking of azoospermia is the most severe form of male infertility. Azoospermia means that there is total absence of sperm in the semen sample. So, whenever we examine the semen sample, then we are not able to find any of the sperm. So, that can be distressing, and this diagnosis can be really, I mean, distressing and unmanageable at the same time, unexpected for some couples. So, it's not very uncommon. About 10% of the male infertility patients can have azoospermia. And the good thing about that is, even in azoospermic male, in three-fourths of the cases, we are able to find some sperms. So, immediately, first of all, whenever the diagnosis of azoospermia is made, the first approach is to repeat the semen analysis in a proper fertility center, with the aim of freezing of sperms if any of the sperm we are getting. As we all know, that the semen parameters are variable many times. So if we are able, we can freeze the sample at the same time. And again, if the same diagnosis is made, that is, no sperms are found, then we proceed towards knowing the cause for azoospermia. What is causing azoospermia? Uh, uh, Broadly, the azoospermia can be obstructive or non-obstructive. It's very important to know that what is the type of azoospermia, as our treatment plan is largely dependent on that. So, in obstructive azoospermia, as the name suggests, there is some obstruction. In these cases, the sperms are produced normally in the testis, but there is some obstruction in the genitourinary system. So, the sperms are produced in the testis, but they are not coming out into the external genitalia. So, in all the cases of obstructive azoospermia, uh, we can retrieve sperm. We can take out sperms directly from the testis with a very small surgery that is called fine needle aspiration of sperms from the testis. We can take out sperms directly from the testis. A local anesthetic is used so that the person doesn't have any pain, and this process can be performed, and we can get sperms. Since the sperms are fewer in number and they are not often motile or mature, so in all these cases IVF is needed for the female partners at the same time. And what we do, we take out the eggs of the female partner, take sperm out of the testis directly, and then with the process of ICSI or assisted fertilization, we inject one sperm inside the egg, and thus the embryo is formed and pregnancy can be achieved in these cases. How do we reach to the diagnosis of obstructive azoospermia? For the diagnosis of azoospermia to be made, uh, we again need the physical examination of the male partner. The testicular size is usually normal in these cases, and in ultrasound examination also the testicular size is normal. Then we look for the vas and the epididymis, and with the help of some blood tests like hormonal tests, FSH, LH, and serum testosterone, these hormones are in usual range. So we reach to the diagnosis of obstructive azoospermia. In other cases, like non-obstructive azoospermia, the azoospermia is present, but that is not due to obstruction. There may be other causes for that. There may be multiple reasons behind non-obstructive azoospermia, like the condition can be present from the birth, as in cases of Klinefelter syndrome. Klinefelter syndrome is a type of chromosomal anomaly in which extra chromosome is there, and so uh, the sperm formation or the sperm production is not proper. So, with the help of karyotype testing or blood test, we can reach to the diagnosis of Klinefelter syndrome. Then, as we all know, that Y chromosome is present in the male counterpart, and sometimes there are specific genes on the Y chromosome that are deleted, that are missed. The genes responsible for formation of a sperm are missed. Uh, are missing, so they are not present. So such condition is known as Y chromosome microdeletion. In these cases also proper spermatogenesis is not there, and diagnosis can be made with the genetic testing of the male counterpart. Then one another congenital condition that is called uh, undescended testis. As we all know that the testis must be present inside the scrotum at the time of birth. They are formed in their fetal life. They are formed inside the abdomen, and then they gradually descend into the pelvis and then into the scrotum. In some conditions, in some of the individuals, the testes have not descended to the scrotum at the time of birth. So these individuals need corrective surgery. Surgery is performed in which the testes are brought to the scrotum and fixed there. That surgery should be done as early as possible, as early as the diagnosis is made, as the germ cell inside the testis are subjected to the higher temperature inside the abdominal cavity, and they are damaged. They do not function properly. So we need to bring the testis down into the scrotum. Then conditions like testicular torsion or testicular trauma may lead to the cases of azoospermia. Also, some cancers like testicular cancer itself or some other cancers for which radiotherapy or chemotherapy is used, that may damage the germ cell of testis and may result in azoospermia or poor semen parameters. Also, mumps or orchitis. Mumps is very notorious for damaging the testicular cells, especially if it occurs after the puberty. It can damage the cells of testis and may result in azoospermia. Then these are the some known region for non-obstructive azoospermia. But in non-obstructive azoospermia also, it is possible to take sperms in some of the cases. As many as 60% of the cases, we can retrieve sperm with the help of surgery. What happens that inside the testis there are multiple tubules that are called seminiferous tubules. Inside the seminiferous tubules, the process of sperm formation takes place. Since the tubules are many in number and the spermatogenesis process is The spermatogenesis process is focal. So, in one part, the spermatogenesis process is happening, in another part, it might not take place. So, during surgery, the surgery is very extensive and that is known as microtessay. So during microtessay, under magnification, we perform the surgery and we try to locate the seminiferous tubule that look normal, and inside that the process of sperm formation takes place. So it takes hours and it's a laborious process, but it is possible to take sperms out in some of the cases of non-obstructive azoospermia. Again, these sperms are used for fertilization with the help of IVF in the female partners, and later on ICSI, we can have embryos and transfer them inside the female counterpart, and the male person can have their own biological babies. Then there is one more issue, that the male partner is sometimes concerned, especially if they have, whenever they have chromosomal anomalies, then they are concerned that whether this condition can be transmitted to their babies or not. So, in all these conditions, the role of genetic counseling is very important. So, all such males in which there is genetic cause for azoospermia, all these males need to go for genetic counseling. Also, pre-implantation genetic analysis or PGD is helpful in some of the cases to test the embryos prior to embryo transfer. So, to summarize, the male infertility is responsible for half of the cases of infertility. So, in half of the cases, the male might contribute to the region responsible for infertility. Then, saying the detailed history and examination as well as some of the blood tests are needed to reach the diagnosis. In some cases, drug treatment, the oral tablets as well as injections are prescribed, and they can help the proper sperm formation to resume again, and the patient can be pregnant in short time. In another cases, IVF with small surgery to take the sperm out from the testis is performed, that is called TESA. And in some cases of even non-obstructive azoospermia, microtessa can help them out. So I think that's all about basics, all basics about the male infertility. If you want to know more details, if you have any questions, let me know about that. Thank you. Yes, there is one question, that is erectile dysfunction also a male infertility factor? Yes, the male infertility can be grossly divided into two parts. First is sexual dysfunction, and second is problems with the sperm. So, sexual dysfunction can be erectile dysfunction or ejaculatory dysfunction. Generally, the drug treatment is available. Oral or injectable medicines are available for that problem. That is given for 3 to 6 months, and usually that problem is addressed. But when there is no relief with the medical treatment, then the couple can go further, and if if they are able to give the sample of semen, then they can be helped out with the help of IUI or intrauterine insemination, or in some cases IVF also. Thank you.